I'm Leslie Ann for This Week in Central New York, and joining me, Ben Everidge, who's the Senior Vice President, Chief Development Officer for Bassett Healthcare Network. And we're going to talk about rural health because that's where we are.
Absolutely. We're in the rural health area.
Yes, welcome. I know that rural health has struggled over the years, just to get funding to support the care that's required for our area. And Bassett Healthcare has been always on the move to seek out funding sources and ways and programs that educate and just kind of the full spectrum. I know you recently had a very interesting idea to put out a license plate supporting rural health care. Why don't you tell us about that, Ben?
Sure, happy to, and thank you for having me. We proposed a new license plate, a distinctive license plate that donors could make a voluntary $25 donation to that would support several different initiatives in rural healthcare. And we call it the Feeling Rural Good license plate.
Right.
Something that you can have a lot of pride in. We believe that rural healthcare actually is a more personalized level of healthcare and something that many healthcare systems around the country could emulate.
Right. In other words, like what are the advantages of that system? Just more time spent with your primary care physician or in general?
Absolutely. Yeah. So our founding physician, Dr. Mary Imogene Bassett, believed that there was always a more excellent way to deliver healthcare in rural environments. And so hers was very personalized. She used to have people come to the hospital. She had people come to her home.
Wow.
She would put them up. She would go to them.
That's personalized care.
That's personalized health care. And that's something that we've tried to do over the years. We've had people come and cook in the cancer center for our doctors at lunch every day.
Neat.
They've reached out. We run all sorts of fairs for people to come and get health care. We'd run school-based programs around the region. We have 21 school-based programs. So it's a personalized level of medicine that you might not find in the big cities.
Right. I know exactly what you mean because we have more resources, at least in terms of people who are passionate and willing to put their own time into providing better health care in a rural setting to give those area residents a better access to health care. And we have, I guess, the downside to rural health is just the funding needed to support these programs. And I know the license plate was an objective to that end. Unfortunately, that didn't turn out the way you wanted this year, did it?
No, it did not. We're going to give it another try and try to make something happen with it next year as well. So we haven't given up on the idea at all. We were very lucky to actually get it through the Senate Transportation Committee, and the Senate was very receptive to it. The Assembly, on the other hand, had a lot of questions about what it could do, what it would do, and they had a very full agenda, so it never did get passed out of Transportation Committee, but we'll try again next year.
There's always next time.
There's always next
try
time.
again.
Absolutely. Just don't ever give up.
Right. Now, you had this idea. It didn't pass this year. So are there any other ideas in the works that you folks are considering?
Number of things. One, we were asked a lot of questions about, well, who would market the license plate? And that's something that we would do at Bassett. We've been trying to build and foster healthy rural communities around the region. We think that that's a natural for us. We've been doing it for 100 years.
Yeah, makes sense.
Yeah, so we'd like to do that again. We're also taking a look at the possibility that we would introduce a plate that would benefit the big cities and their healthcare programs, especially, for example, school-based clinics. Great program, very beneficial. A lot of children don't get access in the cities or in rural communities to healthcare.
You have that in common.
That's exactly right. So that might be something that they would find beneficial. And of course, that would give us even more support in the Senate and the Assembly as well. So we are playing around with that idea as well.
Right. I'd love to hear more about the school-based programs and what that entails. Is it different at each school, or is it a model that's used at each of the schools where it's taking place?
So New York is very fortunate because it has always been a pioneer in school clinics, health clinics in each one of their schools, elementary, middle, high school, and it is a program that is really growing around the state. We operate 21 school-based clinics in our region, which is 8 counties, about the geographic size of Connecticut, actually.
Sure.
And these school-based clinics will offer everything from medicine with pediatric doctors. It will also have dentistry and mental health as well with it. We do annual physicals. We do all sorts of medicine, and we do it year-round with the exception of 5 different holidays that we are not there.
Yeah, that's amazing.
Big program.
If you think about families that just can't afford or don't have the transportation to get their kids to a doctor's visit, there are a lot of impediments that prevent children from getting proper health care. And so that's phenomenal. As a kid in my school, we had annual physicals.
Absolutely.
The local town doctor would come in and we'd have a checkup every year. And then that went away for a while.
It did. That's right.
Yeah.
And so now you do have it coming back, and a lot of healthcare systems around the state are starting to do more of it. This license plate idea would actually help fund
it.
part of that so that more schools around the state, and they don't have to be Bassett-run programs. These are others that can do the same thing and tap into that revenue source since it's a voluntary source of revenue.
Sure. How do the schools get chosen that are participating in that?
So the money in our proposal would actually go to the Department of Health. The committee would actually screen applications, see which ones are worthy. They would recommend it to the department, and then the department would have the ability to decide whether they do or they don't want to do that. So they're the decider of last resort.
Right. Do they tend to be districts that have a lower socioeconomic families, or does it really depend on the situation? Are there a lot of other factors playing
A lot of other factors come into play, but for us, the major criteria is that you're in a rural community. So if you serve a rural community, if your school's in a rural community, you would be eligible to apply for these funds.
Fantastic.
Yeah, so it's a lot of fun.
It'd be great to have that in every school, wouldn't it?
It'd be great to have it in every school.
Yeah.
Such a beneficial program.
Do you have other things to add surrounding rural health? Like, what are the big challenges with getting funding for this?
Right now, for us, one of the other big challenges is just access. It's hard to find a doctor. It's hard to find a place where you can go if you do need more serious care, more acute care, as we call it. You may not be able to do that anymore because so many rural hospitals have closed over the years. It used to be you drove about 8 miles to get to a hospital. Now you're driving on average 25 miles to get to a hospital. And think about that. If you have a heart attack, you have a stroke, you don't want to be driving 25 to 30 or 40 miles to get to a hospital. You need it now.
That's certainly something that has come up again and again in our region with county emergency services and things of that nature.
Absolutely.
So, yeah, it's a challenge that we, of course, have to endure here in a rural area.
Absolutely.
And at the base of it all, you have to have funding to support the services.
Exactly.
So, chipping away, right?
Chipping away just a little bit at a time. We run about $600, $700 million a year as Bassett. We're not your typical rural hospital because we have a very high-end cancer program, orthopedic, surgery, primary care, but we're also partnered for many decades with Columbia University. So when you come to our system for rural health care, you can have a small town doctor helping you. You can have Bassett as a bridge. If need be, you can also be getting help from Columbia University's medicine. So it's a big continuum of care that you get in a rural community.
Fantastic. If people want to learn more about rural health and how they can perhaps support it in our area,
absolutely,
where should they go?
So they can go to bassett.org on the website. They can contact us, and they can also call their assembly person or their state senator and say, hey, we really want this license plate. Why don't you help us get it so we can get that funding?
Yeah, hopefully next year, crossing fingers and toes, that'll happen.
We will do that.
Ben Everidge, thank you so much for joining us on This Week in Central New York.
My pleasure. Thank you for having me.